Earlier today, I spoke about this so-called superbug with Dr. Robert Quigley. He is the Regional Medical Director at International SOS, a foundation devoted to addressing and improving global health challenges. I began by asking Dr. Quigley to explain exactly what these bacteria are and where they come from.
These bacteria are ones that have risen to the top, if you like, as a result of the overuse of antibiotics. And they are bacteria that are resistant to all of the standard antibiotic regimens that exist in present day. The likelihood is these strains of drug-resistant antibiotics is a result of probably several different issues occurring in nature right now. One of them has to do with the fact that much of the livestock that we consume globally is being fed antibiotics at subtherapeutic levels for purposes of growth and confinement. And as a result of that overuse of antibiotics, strains of bacteria are developing that are resistant to the antibiotics. And secondly, in humans, we're finding that there's a very low threshold globally, again, of the administration or the prescription of antibiotics to patients when they have sicknesses. And in hindsight, many times antibiotics are not even indicated. So the combination of those two efforts has resulted in the proliferation or rising to the top of these strains of superbugs.
So I guess the question now is, how does one combat these superbugs? Is the solution just simply stronger antibiotics?
Well, that would be the ideal solution, but we're running out of time, we meaning the global community. The big pharma are not developing antibiotics at a rate that would be appropriate for your solution. And so we have to go back to some of the fundamental principles involved here. We need, obviously, at the consumer level, to make sure that people are practicing proper methods of hygiene. And I'm talking specifically about healthcare workers. But people need to understand the consumer at large needs to recognize that the demand for an antibiotic is not necessarily the solution to the resolution of a viral infection, a standard flu, for example. We need to be certain that that precautions are taken at so many different levels, and we need to encourage governmental organizations at the state level, at the national level, even at the global level, to work with Big Pharma to give them incentives to increase their pipeline for the development of new antibiotics to battle this problem.
You know, you mentioned there the precautions that health workers have to take to combat these bacteria or try to prevent their spread. One of the interesting reports I read was that a lot of these superbugs have actually been found in hospitals.
They are indeed, and in fact, sadly enough, many of these superbugs seem to rest dormantly in nursing homes. And patients will be transferred from a nursing home to a hospital, not appropriately screened, and they get put into a public ward or an intensive care unit or even in the emergency department where there'll be healthcare personnel that are managing several patients at a time. And sometimes hygienic practices, things as simple as washing the hands, are not followed, and it's easy to transmit these superbugs. These superbugs many times exist as part of the flora of one's skin, part of the flora of one's respiratory tract, or part of the flora of one's gastrointestinal tract, and one might not even know that they're a carrier. So it's just as important for these healthcare facilities to develop screening processes so that they can identify these patients when they come into the hospital and isolate them immediately.
And around the world, how widespread are these infections? I presume they haven't yet risen to the level of an epidemic, or have they?
I would have to disagree and say that it is an epidemic. And I have concerns, as do many other healthcare providers around the globe, that this should be treated as we would confront a global issue such as terrorism. The threat is that great. With the globalization of the workforce, the ease of travel these days, these bugs are traveling from one country to another on a daily basis. Drug-resistant tuberculosis, for example, we're seeing in our business on a regular basis. People are doing commerce in areas where drug-resistant tuberculosis is endemic, and then they're bringing it back to their home environment, not knowing that they're carriers, and transmitting it to their coworkers or their family.
Dr. Robert Quigley, thanks for joining us.
My pleasure, Anand.